you've been right in the middle, in the front lines of the COVID battle. But also in the midst of that, anyone that's been paying attention has seen there has been a dramatic increase in suicides, mental health issues, overdoses, alcohol consumption. We go all the way down the list. There's been a huge spike in it. So last year was the worst year for overdoses in this country, in the history of this country. I think it was 92,000. And that's just the people that overdosed. That's not the people, that's the people that passed away. That's the people that died of overdose. That's not the amount of overdoses. I think sometimes people forget that. That number is probably dramatically more, because people being saved with Narcan and people that didn't die from their overdose, that's the amount of people that died from overdose. In the last year and a half, 2 years, what does the ER ICU unit, ICU unit look like for you pertaining to the drugs, the alcohol, things like that?
Yeah, the past year and a half since COVID happened, since the pandemic has forced people to stay indoors, the outlet to drugs and alcohol have substantially increased, and that leads to a lot of overdoses. And we've seen a lot of patients that come in with alcohol intoxication. But it's not just one thing that gets you. It's usually a combination of multiple things. Mm. And being so, one of the most common that we've seen in the West Coast and throughout the country, I'm sure we're seeing spikes in, is methamphetamine increase. The number of methamphetamine overdoses that come to the ICU with strokes, with heart attacks, severe impairment have dramatically increased. And most of the time they add alcohol with it. And lately, we've also been seeing an increase in meth with fentanyl, which is an opioid, and it increases that the need and the dependence of that drug even more. And meth is kind of special because it increases the ability and the work for somebody that they think that they could do in a given time, and it's because you're running on pure adrenaline at that time, when you're on it. But you're playing Russian roulette because inside your body, your heart and your blood vessels are working at a very high capacity. Over time, this leads to weakness and subsequent strokes and heart attacks and other complications from it. Just to point out some of the major ones. Unfortunately, these are the type of patients that come with an overdose to the emergency department and come to my ICU with. If they're fortunate to come in a timely manner with a stroke or a heart attack, there are therapies that we could do to help them. But again, it's playing Russian roulette, and we unfortunately have seen way too many of these to happen, and it gives you a framework of what's happening in society, right? A lot more people are staying in without an outlet, without being able to get fresh air, exercise, without talking to people, without socializing. So these are all important aspects of us being humans.
Absolutely. Vital.
Yeah.